pride of the nation. Why Filipino nurses are in high demand in America. When a Filipino nurse walks into a room, families feel an immediate calm. This video breaks down 10 clear reasons why American hospitals keep seeking our care. Stay till the end. Each segment reveals a tangible skill or cultural strength you can point to with pride. 1. Filipino nursing programs require extended hands-on clinical rotations across adult medicine, pediatrics, obstetrics, mental health, and community health clinics. So, new grads have seen dozens of real patient cases before they graduate. This rigorous exposure produces nurses who can start a shift already competent in bedside assessments, medication administration, and basic procedures. Simulation, labs, and mandatory clinical competencies tighten technical skills such as IV insertion, wound care, and accurate charting, not just theory. Employers in the US notice the difference. Filipino hires often need less supervision orientation time for core nursing tasks. You, as Filipino nurses, carry training that directly maps to American bedside needs, making recruitment a logical choice for hospitals facing staffing gaps. That practical readiness is a source of national pride and a clear reason you are sought after abroad. 2. Filipino nurses are trained to communicate medical information clearly in English during patient education, shift handoffs, and written documentation, reducing errors in fast-paced units. Schools emphasize writing nurses' notes, reading physician orders, and explaining discharge instructions in plain English, so patients actually understand their care plan. Beyond language mechanics, Filipino caregivers excel at culturally sensitive explanations, breaking down complex terms into everyday examples and checking patient understanding. That knack for clear, compassionate teaching increases patient compliance and satisfaction scores, because effective communication saves time and lives. American managers prize nurses who translate medical jargon into reassurance and action. Your voice becomes the bridge between technology and human understanding. 3. Filipino nurses routinely endure 12-hour shifts, overtime during typhoon seasons back home, and the emotional labor of caring for extended families, honing a work ethic that thrives under pressure. That stamina shows in units where sustained focus, quick decision-making, and emotional regulation determine outcomes for critical patients. Many Filipino nurses grew up in households where multitasking and responsibility were daily lessons. Managing siblings while studying for nursing exams trains emotional resilience. Employers see that resilience as reliability. Fewer sick call-outs, steady performance on night shifts, and calm under sudden emergencies. This consistent reliability gives Filipino nurses a reputation as the backbone of many American wards. Your perseverance is not just noticed, it's celebrated. 4. Filipino caregivers bring deeply rooted family-centered care practices into hospitals. They proactively involve relatives in care plans, coordinate family teaching, and anticipate cultural needs such as dietary preferences and spiritual visits. This attention to the family unit improves patient comfort, shortens recovery times, and reduces misunderstandings between staff and families. Practically, that looks like setting up family teaching sessions, making clear home care instructions tailored to the household, and liaising with social workers for elder care arrangements. US teams value staff who can peacefully navigate family dynamics and keep everyone informed, because the Filipino perspective places family at the heart of healing. Nurses from the Philippines consistently raise patient experience scores and build trust with multicultural communities. That empathy is a uniquely Filipino strength to be proud of. 5. Many Filipino nurses arrive with advanced clinical experience in high acuity areas: ICU ventilator management, emergency triage, dialysis protocols, and complex wound care. Skills hospitals pay premiums for. Specific competencies like ventilator weaning, central line dressing changes, and titration of vasoactive drips are learned on the job in busy Philippine tertiary hospitals. Licenses and short-term certifications such as BLS and ACLS are commonly maintained, and countless nurses have months or years of frontline critical care exposure before migrating. Hospitals short on experience, specialty staff actively recruit Filipino clinicians to fill these demanding roles. Your technical mastery in life support and specialty procedures makes you indispensable in US critical care teams. That depth of skill is a proof of Filipino clinical excellence. 6. Working often in resource-limited wards teaches Filipino nurses creative problem solving, conserving supplies without compromising sterility, improvising safe monitoring strategies, and prioritizing interventions when equipment is scarce. These habits develop a habit of clinical triage, deciding quickly which tasks will most affect patient survival. In practice, this means skill prioritization during code situations, efficient use of limited IV pumps across multiple patients, or educating families to safely assist with basic care at discharge. American facilities undergoing surge conditions highly value clinicians who can maintain standards under stress. Your ability to adapt makes you an asset during crisis and routine shortages alike. That resourcefulness reflects Filipino ingenuity and earns respect across healthcare systems. 7. Filipino nurses prepare intensively for international licensure through focus and SELECT-style reviews, mentorship circles, and repeated practice exams that sharpen clinical judgment under test conditions. Many join review centers, take simulation-based practice tests, and log focus pharmacology drills to master US-style questioning and documentation. This disciplined study culture also produces strong application packages, detailed CVs highlighting clinical Rs, reference letters from consultants, and clear competency logs. Recruiters recognize candidates who arrive ready for credentialing and who pass licensing hurdles with focused preparation. Because of this exam readiness, Filipino applicants move through credentialing faster and enter the workforce sooner. Your preparation is evidence of commitment and professionalism. 8. Filipino nurses are culturally fluent with patients from multiple backgrounds. They navigate religious dietary restrictions, respect multi-generational households, and modify care plans to honor cultural rituals while maintaining safety. This cultural competence is demonstrated by asking the right questions about fasting, prayer practices, or visitor roles, and coordinating care that respect those needs. Clinically, that looks like adjusting medication times around religious observances, arranging culturally appropriate nutrition orders, or facilitating family prayer visits without disrupting care. Hospitals serving diverse populations rely on staff who can reduce cultural friction and improve adherence. Your cultural sensitivity makes care safer and more humane, and its position Filipino nurses as natural patient advocates in multicultural settings. That bridge building is a powerful form of leadership. 9. Professionalism is non negotiable. Punctuality, meticulous documentation, consistent infection control practices, and respectful interdisciplinary communication define Filipino nursing culture. Examples include precise shift to shift handoffs, thorough incident reporting, and consistent adherence to sterile technique. During procedures, those behavior translate into smoother team dynamics during rounds and fewer preventable errors on the floor. American nurse managers repeatedly cite Filipino hires for their dependability in team-based care. Your steady professionalism uplifts entire units and earns promotions into charge and preceptor roles. That reliability is a cornerstone of Filipino nursing reputation. 10. Beyond reside care, Filipino nurses amplify healthcare by leading community outreach clinics, mentoring new immigrant staff, and starting patient education programs for chronic diseases like diabetes and hypertension. Many send remittances that support families and fund community health projects back home, creating a ripple effect of well-being. Practically, this means organizing free screening drives, translating discharge forms for immigrant communities, or supervising nurse aides to raise standards across a facility. Hospitals benefit from these multiplier effects. Improve community relations, reduce readmissions, and stronger workforce pipelines. Your influence extends past one patient at a time. You strengthen public health, tie immigrant communities to services, and evaluate the reputation of Filipino care worldwide. That legacy is something every Filipino can proudly point to. Thank you for watching. These 10 truths show how Filipino nurses combine skill, heart, and culture to become indispensable in America. Carry this pride with you. Your work changes hospitals, families, and nations.